Hello, my name is James Harris, and welcome to NCLEX Test Taking Strategies Part 1. When taking the exam, or when it comes around, stay confident in your knowledge. You don't want to be the person feeling stressed as time for the exam runs out. Also, practice early and be prepared for your exams. Learn the test taking strategies and practice them often. Learning your material is important. It is also important to learn test-taking strategies, how to identify keywords, know what the question is asking, and what is directly relevant to the question being asked. You can accomplish this by reading your assigned pages, practicing EAQ questions, paying close attention to the rationales in the remediation worksheets, and asking questions to the appropriate people. Take your time reviewing information and strengthening application of knowledge. As we dive into the actual key test-taking strategies, let's focus on the question. Focus on the data, read every word, and make a decision about what the question is asking. Think, what is the subject and what is being treated or tested? Visualize the event and ask, are there any abnormalities in the data? Clinical judgment for clinical and exams. So you look at the parts of the question. As far as case event and query, has relevant and irrelevant information about the client or clinical situation, and think about the information. With the question query, ask something specific about the case event, whether it's a positive query or negative query. And then options, the answer that are presented, read them all. When reading the questions, identify keywords, diagnoses, and/or medications specified. Avoid overanalyzing and asking, what if? The next part of the presentation will be some practice. Let's go ahead and get started. Question 1. A client newly diagnosed with diabetes mellitus is instructed by the primary health care provider to obtain glucagon for emergency home use. The client asks a home care nurse about the purpose of the medication. What is the nurse's best response to the client's question? As for what's in question 1, focus on the data. What is the data in the question and what is being asked? We see that diabetes mellitus is part of the diagnoses. You see the purpose of the medication, which is related to the glucagon. And then the subject, what is the subject? It is about the medication and the nurse's best response. Visualize any abnormalities in the question as well. In addition, you want to think, what is the case event or query? Is there relevant or irrelevant information? Sometimes these questions have more information than you need to know, and other times it's more specific to what is given. Then also think, what is the question query? What specifically is being asked? Here, what is the nurse's best response to the client's question is the question being asked. Question 2. The nurse is caring for a client who has a fever and is diaphoretic. The nurse monitors the client's intake and output and expects to note which finding. In question 2, we'll focus on the data. What is the data in the question and what is being asked? The data shows that the client has a fever and is diaphoretic, which means sweating, and the nurse monitors the client's intake and output and expects to note which finding. That is the main subject of the question is the intake and output. And then visualize any abnormalities in the question. Here it is the patient or client has a fever and is diaphoretic. So we want to know what is our assessment data going to look like. Another question to consider, what is the case event or query? Is there relevant or irrelevant information? Most of the information in this question is relevant, and we also want to think, what is the question query? What specifically is being asked? The nurse monitors the client's intake and output is what the assessment is, and expects to note which finding is the question being asked. A big thing about test-taking strategies is practicing questions. Practicing more questions will really help in developing those test-taking strategies and knowing how to find keywords, understanding what is given, what is needed, and what is being asked. At the first, you don't want to worry about the answers yet. Identify the parts of the question. What is the data? What is the focus? And what is in the subject? Visualize the scenario the best you can and think of what is the event query. Is it a positive query or negative query question? Is data relevant or irrelevant? And what is the query? What is the specific question being asked? Next, more key test-taking strategies will be up. Strategic words make all the difference. Look for them. Are they positive or negative? What does the question want to know? And what if? Don't go there. Only consider what is in the question. Positive and negative query questions will be discussed more in Test-Taking Strategies Part 3. This concludes the presentation and introduction on NCLEX-RN Test-Taking Strategies Part 1. Thank you for listening.